So I'm about to do my first Profhilo treatment. I've never done this before. It will involve a few little shots of hyaluronic acid, but it's, what I understand is it's not a filler. It just puts hydration into your skin. So here goes.
What we're going to do today is a treatment with Profhilo. This is a combination of high density and a low density hyaluronic acid. Hyaluronic acid is naturally found in our skins, and it's responsible for holding water and hydrating the skin. So what we're going to do is inject this into 5 points on either side of the face, and what it does is that over a period of a few days to a week, it will spread throughout the dermis because it moves freely within the different planes of the dermis, and it will start to hydrate the dermis, which gives a much plumper, more bouncy feel to the skin. And it's great for fine lines and wrinkles. A typical treatment program would be to have 2 treatments about 5 to 6 weeks apart. And the results, the best results, are going to be seen about 6 weeks after the second treatment. You look here. One injection there. Straight ahead. And for your lip, I'm also going to do one injection just there. Okay.
Right, so I just had it. As you can see, I'm a bit red and bumpy, and yeah, it did hurt a bit actually. It was a little bit of a pinch, so I did feel it, I'm not going to lie. And I've got little bumps that, funnily enough, we were just talking about the fact that the left side hurt a bit more than the right side. But these bumps should go down very quickly. I just got back from my Profhilo treatment, and already the redness is gone. There's a bump there, and a little bit there. But hopefully that'll be gone in the morning. So a few weeks have gone by. I actually didn't wait the 5 to 6 weeks that Dr. Khan said. I'm back to see Anna, who's actually the main practitioner of Profhilo at the Harley Street Skin Clinic. And I've only waited 3 weeks, but Anna said that was okay.
Yes, absolutely.
Great. So that is the minimum amount of time though.
Yes.
But I just wanted to say that after my last one, I showed that I had a bit of redness and I had a few bumps, and they really went down very quickly. The bumps were a little bit visible the next day and were sort of almost completely gone the day after, but not enough that I couldn't go out or anything like that, so it was absolutely fine. However, I just want to say that everybody is different. So some people may have more bumps, and it's also, whenever you have an injectable, it is possible to get bruising. So I just want to point that out. These things can happen. So I'm here today for my second and final treatment, because you only need 2.
Yes,
Profhilo.
absolutely. In some cases, very much depending on the condition of the skin to start with, possibly the age of the patient, the condition of the skin.
Old, very old. Not at all, but looking fabulous.
We may make the decision possibly at 8 weeks, so that would be 4 weeks after the second treatment. We may decide at that time possibly to do a 3rd treatment in that initial course. But that's obviously, a decision that we make on a very much a case-by-case basis, and certainly not something that everybody needs. By any means.
Okay, well I shall remember that because, as I said, I am quite old, and I'm probably going to need all the help I can get. So
Okay.
we'll do it today.
Yes.
And then how long should I give it before we?
I would give it a good 4 weeks after today's treatment for us to regroup.
And to see how this
photos.
is. So after 4 weeks after today,
Yes.
I should be seeing
what we
visible smoothing,
Absolutely.
plumping.
Increased firmness to the skin, better luminosity. We often find as well that even individuals perhaps that might even be concerned by the appearance of enlarged pores even here, or just around the chin area, or textural changes around here, we often find actually that those are concerns as well that even seem to improve with Profhilo, possibly because this incredible tightening effect that it gives to the skin, but also the very high concentration and the pure concentration of the hyaluronic acid.
I mean, it does sound amazing. Do you know, there's something that confuses me, because it's hyaluronic acid.
Yes.
Now, if one had fillers, would that be hyaluronic acid, or is
It
that
would. No, it would. And it's a really good question, because I think
Because it's not a filler.
Yes.
So why is it not a filler? Why, when it's a filler, is it a filler? And if it's Profhilo, it's just hydration?
Yeah, absolutely. And again, a really good question. Fillers are formulated in a certain way that means that when they're placed in the skin, they almost like immediately reposition and give structure back to areas where there's more shadowing, particularly sort of nose to mouth area, or areas where the light just doesn't bounce off the weight of the skin in the way it did because of shadowing, because of deeper volume changes in the skin. When we work with Profhilo, it's a technology, essentially, or a very sophisticated hyaluronic acid that purely treats the skin alone. So it's not designed to work deeper, to actually almost, smooth and contour areas and restructure the face as such in the way that the fillers do, which is why we don't see that immediate correction with Profhilo. It's something that's almost placed in the skin in a very formulaic and strategic way. And that means that the hyaluronic acid has been formulated to almost talk to the cells in the skin to get them to very gradually bioremodel, and that basically means to almost heal themselves from the inside out and to stimulate these different types of collagen across each layer of the skin. So
it stimulates the collagen.
Yes.
And am I right in thinking that it's like giving your skin a super hydration boost?
Absolutely.
Because as you get older, that is one of the things in my youth, I had quite an oily skin. Well, those days are long gone. I wouldn't call it dry, my skin, but I would, it does just look so dehydrated sometimes. You think, I just need some dewiness and some plumpness in there.
So I think, very, very common concern that we hear from men and women alike, and certainly because the concentration in the product, so it's 64 milligrams of hyaluronic acid, and the average concentration, say for example in a dermal filler, is approximately 20, 22, 24, even 25 milligrams. So on the hyaluronic acid concentration alone, as you say, almost everybody notices the incredible level of hydration and firmness as a result of that they get from Profhilo, because it's so pure and there's absolutely no chemicals in it either, so it's very
hyaluronic acid is a natural ingredient that we have in our skins anyway.
Absolutely.
It's just as we get older we have less.
Yes, exactly.
Okay. Well, it sounds great. And now's the bit I'm not really looking forward to. Shall we do it?
Yes, let's do it. Okay. Let's do it.
So I've just done my second treatment, and I'm less red this time. I was very red for about an hour afterwards last time, and I've got a few bumps as before, although I think they're slightly less bumpy. And it's interesting because Anna, who's an absolute Profhilo pro, she does a lot of these, and she had quite a different technique. She puts it in much slower, and actually I found that a little more comfortable, because needles aren't my favourite thing, I have to say. So I did find that a bit more comfortable, and we were talking about the fact that we might go for a third one, depending on how my skin is looking in about a month, just to get the really, really best result. And I love the idea of putting all this natural hyaluronic acid into my face and just giving my skin a real hydrating boost. So I've got great hopes for this treatment. It's the day after my second treatment, Profhilo, and my skin is pretty good today. I've got a little bump here, and that's about it. Absolutely nothing. You would never know. I had no redness. So actually it was there was a lot less of a reaction this time, and I'm sure that bump will be gone by tomorrow. So I'm here, and I've decided to come for a third treatment, and I'm about to do it, and Anna just said, "Hi Anna." Where are you? And I walked in and she said, "Wow, your skin looks amazing." And it's very hard to tell on your own skin, but I was thinking it looked plumper and fuller and hydrated. So I'm here for the third treatment, and then the next time you see me, I'm going to show you the results in a few weeks.
An older patient, perhaps perimenopausal, menopausal or older, or if the condition of the skin to start with, if the overall quality is quite poor, perhaps there's a lot of laxity, then generally for those types of patients, men and women alike, we would suggest that probably the need for a third treatment is necessary only because Profhilo is almost talking to the receptors of the cells in the skin to get them to wake up and to start regenerating and producing new collagen. And naturally with age, particularly with ladies, what can happen is that those cell membrane receptors just become a bit sleepy and just need sometimes that third treatment just to wake up.
But you
and
think
to get stimulated.
Profhilo will work if you're older?
Absolutely. The only thing we just have to factor in is that the likelihood or the increased likelihood for the need for that third treatment.
Right, okay.
So in many cases, the third treatment is necessary just in the initial course, and then it can be maintained again, perhaps at 6 months, even with 2 treatments.
Right.
Or even every 3 months with a single treatment. So it depends on budget, it depends on indication, the condition of the skin, how well the skin's improved, and also what other types of treatments somebody's having to maintain the skin quality overall, because Profhilo arguably will bring out the best of other treatments for sure, but equally other treatments that are focusing on the skin quality can do, can have a likewise and a similar effect and almost bring out the best of Profhilo as well.
Correct.
So it's been a good 6 weeks since my third and final Profhilo treatment, and I am very pleased with the results, I have to say. It can sometimes be hard to see the difference on yourself. You sort of need other people to tell you. But what I have noticed is a plumping up of the skin. And in fact, while I was in the middle of the treatment, my face even looked fuller, which when you're younger may not be what you want, but as you age and you lose volume in your face, that's not a bad thing. That seems to have gone down a bit, I think, although I still think my face looks a little bit fuller. But there's a very nice, sort of almost slightly filled quality just overall on my skin. Regarding specific areas like my upper lip, if I'm honest, I'm not sure I see a difference there specifically, but I do see a difference in the tone of my skin. And I was having a different facial-like treatment the other day, and the therapist said, your skin is different, your skin feels firmer, it feels thicker, and she could feel a physical difference in my skin. So yes, I'm very pleased with the Profhilo. And what I would say is, the older you get, the less effective a lot of treatments are. So I would highly recommend, if you're 50 plus, 55 plus, I would recommend, and certainly if you're 60 or in your 60s like I am, I would definitely recommend going for the 3 treatments, definitely. But no, the Profhilo definitely gets a thumbs up from me.